My name's Kevin Hague and I'm the Green Party's spokesperson on health and wellbeing. I've, prior to becoming an MP, spent about 20 years in the health sector, mainly in public health and health promotion in particular, but actually exploring other aspects too. I was the chief executive of the West Coast District Health Board immediately before becoming an MP, and I was also previously the director of the New Zealand AIDS Foundation and was a member of the National Health Committee, the chair of the Public Health Advisory Committee, member of the Quality Improvement Committee and the National Screening Advisory Committee, and more besides. You don't need to know that. When it comes to health and wellbeing, the Green Party has a very strong focus on upstream factors. You know, we're interested in what are the socio-environmental causes of ill health. How could we intervene to prevent illness from occurring? And you'll see a lot of that in Green Party policy. So, for example, at this year's election, one of our flagship priorities is around raising 100,000 kids out of poverty. We've got over 200,000 kids living in poverty in New Zealand, and that just can't be acceptable. And as you'll all know, has massive effects on those kids later in their lives, both health, education, and all of the other outcomes. So we've got a range of policies to deal with that, and that's typical of Green Party policy. We see a continuum of health services, from at one end public health services, then primary care, through secondary care, right through to tertiary and even quaternary care at one end. And we believe, as in fact most countries around the world and New Zealand until this term of government has believed, that what we should be trying to do is shift the point of intervention towards the public health and primary care end of things. And we know that that not only produces the best health outcomes, but also the best return in terms of health gain for the investment that we make. Our policy is to increase progressively public health spending to about 10% of vote health, and also to increase the proportion that's spent on primary care. That's sadly the reverse of where this government is taking things. They've actually taken money out of both public health and primary care in order to fund the increased elective surgery and the increased specialised services. We think that's wrong. A lot of people would say that because of the straitened financial circumstances the country finds itself in, that we need to economise in health, we need to spend less. We don't accept that. We believe that health spending actually needs to keep pace with the need for health services. And we point to the fact that at the same time that the government is cutting funding to health and education and other social services, at least in real terms, it is choosing to spend tens of billions of dollars on, for example, the roads of national significance and tax cuts for those who are already the wealthiest. So the choices that are being made reflect different values and different culture, not the fact that there simply isn't enough money. Now when it comes to primary care, the Green Party is a supporter of the PHO model. We think that is the right way to go. But what we would say is that the way that that model has been implemented has not been quite right. We've been very successful in enrolling a lot of New Zealanders with PHOs, but at the same time we haven't been nearly as successful with some of the other objectives, such as great population engagement with PHOs, the adoption of public health models by PHOs to keep capitated populations well in the first place, and in particular the development of multidisciplinary teams so that we actually use the resources and skills of our primary care professionals as efficiently as we possibly can. I think all of those require a greater emphasis, and one of the ways that we can do that, of course, is by exploring and supporting a wider range of business models for general practice and for primary care services. In particular, we think there's scope for more salaried models whereby PHOs, for example, might be the employer of GPs and practice nurses and so forth. And that would certainly help with all of those other objectives. Finally, on November the 26th, you're going to have two votes. One is in the general election and the other is in the referendum on the future voting system for New Zealand. In that second vote, in the referendum, we would say it's important to keep MMP because of all the systems that are on offer. MMP is the only system that delivers representation in Parliament in proportion to how people have actually voted. It's the only proportional system, and it's delivered gains for New Zealand, and we need to keep MMP. In your vote in the general election, we are asking that you consider the Green Party for your party vote. We believe we have strong health policy, and we look forward to your support.